Okay, thank you so much for joining us today. Today we have a presentation of a webinar on myopia. I am Genevieve Fay, Senior Market Director for Haag-Streit, and it's my pleasure to welcome Dr. Rupa Wong for our featured speaker today. Dr. Wong is a board-certified ophthalmologist and surgeon with a specialty in pediatric ophthalmology and adult strabismus. She's completed her medical school training at Cornell University and did a residency at NYU's Manhattan Eye, Ear, and Throat Hospital, serving as chief resident in her final year. She then served her fellowship at Harvard University's Boston Children's Hospital, staying on as a faculty for 1 year before starting her own private practice in Oahu, Hawaii. In addition to her published articles and studies, Dr. Wong also serves as an assistant clinical professor of medicine at the University of Hawaii, and she's an expert and very passionate speaker on myopia. We are very honored to have her with us today. So I'm going to start with just some notes, some housekeeping notes. Okay, sorry about that. Thank you. So for questions, please use the Q&A feature that's on the bottom of your screen and not the chat feature. You'll see both. And then also please know that the session that we're doing is being recorded. Okay, thank you. And so with that note, I'm going to turn over my screen to Dr. Wong. Thank you, Dr. Wong, for joining us today.
Thank you so much for having me. I appreciate the opportunity to talk about a topic that I'm extremely passionate about. All right, everybody can see that, right? So we're going to be talking today about a proactive management approach with Lenstar. As Genevieve introduced me, that's such a nice introduction. I am practicing out here in Honolulu, Hawaii. So I have a very large Asian population, mixed Asian population, which of course, if you're familiar with myopia management at all, you know that that puts kids at risk. But before we dive into the research and to my protocols and how I use the Lenstar Myopia, I wanted to talk about why I'm so passionate about this particular topic. This is my why. My husband and I are approaching our 15-year wedding anniversary. We met in ophthalmology residency in New York, and he is obviously of Chinese ethnicity. He's a fifth-generation Chinese American, born and raised here in Hawaii. And in addition to being an amazing cataract surgeon and cornea specialist, he has very long eyes. His axial length is around 28 millimeters, if not a little bit longer. So when I started reading these initial studies coming out of Singapore, I knew that this is something likely that would affect my children. I'm a latent height growth, but I knew they weren't probably going to trend in my direction. And so this is why I'm truly so passionate about this particular topic, because I personally wanted to be able to prevent myopia in my 3 children and also for my patients. So the prevalence of myopia is increasing. We all know this. Half the world's population may be myopic by 2050, with 4.8 billion people becoming nearsighted. And high myopia is emerging as a major cause of blindness in Asian countries. The prevalence in East Asian countries is reaching 70 to 80%. And 65% of Singapore students are myopic by the age of 12. But this also does affect the United States. It's not just something that's worldwide or in Asian countries. Myopia has doubled over the past 30 years, and the prevalence of people who are over -8 diopters has increased 8 times. So before the pandemic, in pediatric ophthalmology circles, we used to call this the next epidemic. And we are a little hesitant to use that word, but it's very true. And what's very interesting is the onset of myopia. So in 1983, the average age of onset of myopia was 11 years old, the age of my oldest son in this photograph. In 2000, that dropped to 8 years old, the age of my daughter in this picture. So not only are people becoming myopic at an increasing frequency, the age of onset is earlier. And that's going to be problematic. I don't know how many of you all were involved in distance learning. This is a TikTok I had made about 6 weeks into distance learning with my daughter. Don't understand. Don't understand. So distance learning, and this is where I actually wanted to do a quick poll, but when they were able, this is a great article that had come out in JAMA Ophthalmology, and they actually examined the 2020 school year in its entirety in China because their school year runs from January to January. They found that 6-year-olds had a 3 times increase in myopia, and 8-year-olds had a 1.4 times increase in myopia. So if you wouldn't mind, we're going to do a quick poll. How many of you currently do myopia management in your practice? That poll feature is going to be coming up. All right. So if you can answer yes, I do, or not currently. And then if you are here, are you here mainly because you're concerned about your own children like I was because of the development of myopia? You wouldn't mind answering yes or no? Yes or no? I think that would be really interesting. Awesome. I can't see. Does that poll, Genevieve, come up? The answers come up somewhere?
Yes, absolutely. So right now, Dr. Wong, we have about 48% are treating myopia and about 62% are worried about their own children.
So more worried about their own children than are actually treating myopia. And when I asked this question at a couple ophthalmology conferences I presented at a few months ago, that was pretty much the same response. A lot of us are concerned about our own children, and just as I am. So risk factors: time spent outdoors or minimum amount of time spent outdoors, parental history, near work, age and ethnicity, and being a fast progressor. So this is a schematic I actually have on my website that I created. I give out to my patients. Just a rough estimate that when both parents are myopic, there's a 1 in 2 chance that the child will be myopic as well. When only one parent is myopic, there's a 1 in 3 chance that the child will be myopic. That drops to 1 in 4 when neither is myopic, so obviously not 0. And the risk factors of insufficient time outdoors, as well as modern lifestyle factors of prolonged time spent reading or on a digital device, especially exacerbated by the pandemic and distance learning. So you can see that the amount of studies and the interest in myopia control has really skyrocketed in the last 2 years, especially given the amount of time that children are on these devices. So for prevention of myopia progression, orthokeratology is one of the options that's available. I expect some of you are doing this in your practices. Soft contact lenses, peripheral defocus. Some people still do progressive or bifocal soft contact lenses. Low dose atropine, recommending outdoor time, recommending decreasing near work. And then the spectacle lens, the Hoya or the Essilor, which are not available where I am here in the US. We're hoping at some point will come soon. So outdoor time. The benefits of outdoor time have been studied in numerous countries: China, Taiwan, Australia. So it signifies that it's across this effect, this protective effect is across very many different types of ethnicities and races. And they found in many of the studies that even just moderate sunlight, 11 hours a week, is sufficient to decrease myopia by 23%. And that this outdoor time did not need to be physical activity dependent. When they compared kids who were doing indoor sports versus outdoor sports, the ones that were doing outdoor were far beneficial. There was no protective effect of being active indoors. So it just has to do with the sunlight. More outdoor time equals less myopia. You can see from this odds ratio chart here. And it's certainly more protective when a child has increased near work. As you all know, myopic eyes are long, and the fast progressors are the kids who are myopic at a younger age, which is why this decreasing trend towards the age of onset is really worrisome. JAMA Ophthalmology published this, which showed the association of axial length with risk of uncorrected visual impairment. And it's very striking that 26 millimeters, 5%, over the age of 60 have this risk of uncorrectable visual impairment, which obviously increases as you go to 28 and over 30 millimeter eyes. And the same when you look at the spherical equivalent, which is why most of us think of high myopia as being -6 diopters, because there's such an increased risk associated with that refractive error. What are the ocular consequences? Why do we even care? I tell parents, I don't care how thick the glasses are. I care about the vision-threatening consequences of their child's myopia for them in the future. Retinal tears and thinning, retinal detachment, posterior scapulomas, lacquer cracks, myopic maculopathy, CNVs, glaucoma, cataracts. The risk of cataracts, retinal detachment, myopic maculopathy. And this is really one of those, I think, graphs and tables that really drives the point home. If you're highly myopic, you have a 5.5 increased chance of a PSC cataract, 21 times increased risk of retinal detachment, and a 40 times increased risk of myopic maculopathy. Myopes are at higher risk of developing glaucoma. There's an odds ratio of 2.5, even if for just moderate to high myopia, and a 1.7 increased risk for low myopia. The tilted optic nerves make a glaucoma diagnosis very difficult. So when I'm seeing it in younger patients, it's not so problematic, but certainly if those younger patients are now 60 or 65 following with the adult ophthalmologist, then it can be difficult to tease apart. The risk of retinal detachments is 5 to 6 times greater in people with high myopia compared to low myopia due to the retinal thinning and tears. And again, just the odds ratio, which is really very glaring about myopic maculopathy. It is the leading cause of vision impairment and blindness in myopes, and it's the most frequent cause of visual impairment in elderly Chinese in Taiwan, as well as the primary cause of blindness in Tajimi City in Japan. But it's not just, again, in Asian countries or Asian individuals. The Copenhagen study did find that myopic retinal disorder to be the most common cause of impaired vision, with myopic maculopathy being the third most common cause. And these findings were also shown in the Los Angeles Latino Eye Study, with the third most common cause of blindness being myopic maculopathy. The living with myopic maculopathy, that certainly cannot be underestimated. The average age is just 47 years old when individuals are affected, and their best corrected vision is 20/50. In this country, you can't drive a car with 20/50 vision. So this is something that truly does impact our myopic individuals. A study of cataracts, a meta-analysis of 38,000 patients from 12 population-based studies showed that myopia is associated with nuclear and posterior subcapsular cataracts. And the complication risk increases. Most of you might be adult ophthalmologists. I no longer perform adult cataract surgery. I leave that to my husband. But posterior capsular rupture, retinal detachments after cataract surgery, progressive myopic traction maculopathy, capsular contraction syndrome, and even